I'll knock on my patient's door. He'll let me enter. I'll introduce myself. Good morning, my name is Claudia. I'm gonna be your nurse today. And we're going to be going over our hair, skin, and nails assessment. So first I'm gonna start off by asking 2 questions. My first question, have you noticed any changes in your moles, any changes in size, shape, or color?
No.
Okay, next question, have you noticed any recent excessive dryness or itching on your skin?
No.
No, okay. So the next portion of our assessment, we're gonna be just inspecting and palpating the skin. So I'm just gonna start off by looking at the color of our face, chest, arms, and legs. I wanna make sure that there is no pallor, which is paleness. I wanna make sure that there is no erythema, which is redness. No jaundice, which is yellow, like yellowing of the skin, or any signs of cyanosis, which is blue. But it looks like our patient's skin is nice and pink. And while I'm here, I also want to check the temperature. So I'm gonna be checking the temperature with the back of my hands. And I'm gonna be checking upper and lower extremities and making sure that the temperature is nice and equal and temperature is nice and warm. Then I'm looking at the texture of the skin, which is smooth, and the skin is nice and thin, which is normal. I'm also noting that there's no edema in the upper extremities or the lower extremities. And I also want to check the mobility and turgor on the chest. So how we do that, we're just going to pinch the skin right here. And we want to make sure that the skin rises normally without any difficulty, which is the mobility. And the turgor is making sure that the skin goes back down with no tenting. So that's good. Lastly, I want to take a look at any lesions or abnormal markings on our upper and lower portions of our skin. So I see here that the patient has freckles or macula on his anterior and posterior shoulders here, and these are flat and light brown to the color. We also see very few moles or papules. They're all less than 6 millimeters in diameter and all light brown to the color. No other lesions or abnormal markings on the top portion. Now we're going down to legs, and I don't see any freckles or lesions or other moles, but I do notice that there is a new little lesion above the right kneecap. It isn't elevated, it isn't draining, and it doesn't seem inflamed. So it looks like it's healing nicely. How did you get this little lesion?
I got it at work. Nail hit me.
Okay, well, it looks like you're doing a good job cleaning that, so just continue doing that. It looks like it's healing nicely. After that, I just want to take a look at your back also and note the same thing. So we're looking for any lesions or abnormal markings. Again, there is a lot of moles on the posterior side. There are flat macules, again, light brown to the color. So we're done with this part. After that, we are going to go over our hair inspection. So just by looking at it, our hair is ashy blonde. Our texture is smooth and thick. The hair distribution is nice and symmetrical, and while I'm parting the hair here, I'm looking for any lesions or infestations, but my patient's hair and scalp is clean and dry. So after that, I want to go over our nails. So we're gonna be looking at our upper extremity nails here. We wanna make sure that the color is pink on all 10 nails. Here we can also check capillary refill on all 10 nails. And we're just looking for that blood to come back and making sure that it's less than 2 seconds on all 10 fingers, which it is. After that, we can check the consistency of our nails, which they should all be nice and firm and no sponginess. And then after that, we want to make sure that our nail profile here, put your nail like this, that our nail profile is less than 160 degrees and our nail shape is nice and flat. So after our upper extremity nails, we want to go down to our lower extremity nails. And here, same thing, I'm noting the color, which is pink, on all 10 nails. We can do cap refill on all 10 fingers, which should be less than 2 seconds, so blood return is good. After that, we can also check the consistency, which is nice and firm. We're also checking the nail shape. Down here, they're slightly a little bit more rounded, but that's normal. And our nail profile here is less than 160 degrees on both feet. And before I finish off my hair, skin, and nails assessment, I just wanted to go over a few ways you can kind of monitor your moles, and it's also a way to prevent the risk of getting skin cancer. So the way we do that, we have an acronym, A, B, C, D, E. A is for asymmetry. So you want to note any asymmetry in your moles. You want to make sure that all sides of your moles are equal. Then B is for border. We want to make sure that we don't have any irregular borders, and we want to make sure that our moles are nice and smooth. C is for color. We're making sure that we don't have multiple colors in a mole, such as brown, blue, black, red, or white. D is for diameter. We want to make sure that our moles are less than 6 millimeters, and we can reference to the tip of the pencil eraser, so they should be smaller than that. And E is for elevation and enlargement, and your moles just should not be getting any bigger within any recent time. And that is all for my hair, skin, and nails assessment. Thank you.